Thinking about peeling? Do you know the risks and benefits of the practice? The skin has two layers, the epidermis and the dermis. The epidermis is the thin layer in contact with the outside. It is very thin since its thickness is only 0.02 mm on the face. Peeling is an act consisting in applying a chemical substance to the skin, usually an acid, in order to cause a limited and controlled destruction of the epidermis or even the superficial layers of the dermis. The purpose of this destruction is to obtain regeneration of the destroyed layers and to stimulate the production of elastic fibers and collagen in the underlying layers, in order to densify the skin. Thus the peel helps to fight against heliodermatitis, sun-related skin damage, brown spots, dull complexion, small wrinkles, skin pigmentations such as the pregnancy mask, acne, especially with comedones and microcysts, pigmented spots after acne, pimples and acne scars, stomach aches, fatigue, migraines. The superficial peel. Superficial peeling causes destruction of the most superficial layers of the epidermis. This is the type of peel most often used in dermatology. The products used. Glycolic acid peel. The substance most commonly used by doctors is glycolic acid in a more or less concentrated solution 30% to 70% and at a more or less acidic pH. Glycolic acid is a fruit acid alpha-hydroxy acid or AHA extracted from sugarcane, which decreases the adhesion of corneocytes, the skin cells constituting the stratum corneum, the most superficial of the epidermis. It is a non-toxic substance and does not cause allergies. The practitioner applies the product using an instrument, compress, brush, cotton, etc. to the skin of the face. Several sessions are necessary between 3 and 10 in general, spaced from 1 week to 1 month, in association with evening applications of a cream containing glycolic acid. The aftermath of the peel is marked by pinking of the skin and desquamation. Peeling OTCA. The other product commonly used for superficial peels is trichloroacetic acid TCA diluted between 10 and 25%. TCA is a trichlorinated derivative of acetic acid, the acid of vinegar. It is a non-toxic and non-allergenic substance. Weakly concentrated TCA applied to defatted skin causes icing, whitening and pinking of the superficial layers of the epidermis. The practitioner begins by degreasing the skin using ether or acetone. He then applies the TCA using an instrument, compress, cotton swab, etc. This application is often painful, the patient complaining of a hot or even burning sensation for a few minutes, when the icing of the skin appears. The practitioner can then perform several passes and then apply wet compresses to relieve the feeling of heat and stop the action of the TCA. The practitioner determines the depth of action of the average peel according to several parameters: the concentration of the TCA solution. A 25% TCA penetrates deeper than a 10% TCA. The application technique: vigorous rubbing of the area to be treated using a compress saturated with TCA is more aggressive than sweeping with cotton wool. Repeating the applications increases the depth of the peeling. With each new application of TCA during the same session, deeper and deeper, damage is created in the epidermis. Skin type. Thin skin is more sensitive than oily and thick skin. The treated area, the skin of the eyelids, is much more fragile. For example, the aftermath of the TCA peel is marked by pinking and flaking for about a week. More rarely, the dermatologist may use resorcinol paste, which is more difficult to handle. Need for a test behind the ear to detect an allergy to resorcinol. Sensation of heat when applying the preparation to the face. Skin becomes brownish and flaky after a few days, requiring social exclusion for a week. Indications for superficial peels. Superficial peels with glycolic acid and TCA are indicated in case of heliodermis, sun-related damage, improvement in complexion and skin texture, reduction in brown spots, reduction of superficial fine lines, pregnancy mask, from acne to comedones and microcysts, in association with dermatological skin cleansing. Complications of superficial peels. Complications of superficial peeling are rare, but may be of the order of reactive hyperpigmentation in the event of too early sun exposure on dark skin, or the appearance of scars in the event of accidental destruction of the epidermis scabs. The medium peel. This is a peel that affects the layers below the horny layer of the epidermis. They have the same indications as superficial peels: heliodermia, improvement of skin tone and texture, reduction of brown spots, reduction of superficial fine lines, pregnancy mask, acne with comedones and microcysts, in combination with dermatological skin cleansing, but they are often used as a second intention, when the superficial peeling does not give the expected results. Trichloroacetic acid TCA diluted from 30% to 50% is generally used for this type of peeling. The procedure is the same as for the light TCA peel. The practitioner determines the depth of action of the medium TCA peel according to the same criteria, namely the concentration of the TCA solution. A 50% TCA peel penetrates deeper than a 30% TCA. The technique of application, the repetition of applications which increases the depth of the peeling, the type of skin and the area treated. The immediate aftermath of the medium peel is marked by the appearance of swelling of the skin edema which disappears in 2 to 3 days. The skin then becomes brownish and peels off in 1 to 2 weeks, revealing a smooth, pinkish skin. This pinkish color often takes several months to disappear, and as long as it lasts, avoid exposure to the sun, otherwise you will see appear brown spots. The practitioner generally recommends cleaning the skin with thermal bombs, then disinfecting it with a mild antiseptic aqueous chlorhexidine, for example, and applying greasy ointments to help healing. Complications of medium peels. Bacterial infection that can be prevented by antiseptics and daily cleanings. Herpes infection. In the case of cold sores, the herpes virus can spread to the treated areas and give generalized facial herpes. To avoid this, the practitioner can prescribe valacyclovir, from the day before the peel until the end of healing, especially in the event of a history of cold sores. Indented or raised scars, hypertrophic scars, white scars or brown spots of pigmentation. The deep peel. The deepest peels, used more rarely than superficial and medium peels, are more reserved for deep wrinkles and hollow scars. The product used is generally phenol carbolic acid, a poison derived from benzene, which applied to the skin, causes a strong burning sensation and whitening of the skin by coagulation and destruction of the epidermis.